Hello, I think we're going to get started, everyone. It is Monday, October 5th, and it is Mental Illness Awareness Week, and we're very happy that you guys have joined us. We will also be recording this session, and it will be made available. We have a number of schools and other groups that were asking for this content. We are very happy today to have Dr. Rob Meeder with us, and he will be discussing anxiety in children. And this session today is actually sponsored by Gilcon Construction. So thank you very much to Gilcon for making this possible. All of these programs are being provided free of charge. However, if you would like to make a donation to the hospital in support of the COVID-19 Mental Health Relief Fund, there is a link for that on the website at www.waypointcenter.ca. So thank you so much. And Rob, I will let you take it away.
Great. Can you hear me okay, first of all? Maybe Shelley or Holly can just confirm that my audio is coming through.
Yes, you're all good. We can hear you.
Okay, great. Excellent. And hopefully you can see my screen as well. And I'm going to just push play here. So again, let me know if that's not the case, but I assume that's the case. So thank you, everybody, for logging on today and joining our session today. I'm really excited and pleased to be asked to give this talk and actually to share with you a number of times this week about children's mental health issues. I have a real passion for this as a pediatrician, and I'm so pleased to be joining the staff here at Waypoint to really pursue this direction of children's mental health. And this is relatively new for Waypoint and for myself to be in this position. And I do believe that addressing children's mental health issues early on in life pays huge dividends down the road, not just from a physical health perspective, but also definitely a mental health perspective, both perspectives. And that's why I think this is so important a topic. We'll talk about anxiety today. We've got ADHD on the schedule, we've got autism, developmental trauma, and then some collaborative problem solving techniques and approaches you can use with kids. So hopefully you'll be able to log on to some more of these sessions throughout the week or listen to them after they've been recorded. I hope this will be of benefit to you and that you'll be as equally passionate about children's mental health care as I am. I'm going to just give a little bit of a talk at first, and then I'm just going to open it up to questions after that. I'm not going to talk the whole hour. I think we'll be maybe 30 minutes or so, and then we can take it from there. So childhood anxiety. So let's talk about that. And oh yeah, before I start, again, thanks to our sponsor, and thanks to all the sponsors this week of the talks. I was thrilled to see local businesses jumping on board with this great cause. So please do support them as well. All right, childhood anxiety. So this is a statement that I think has really impacted me when I look at kids who come in with various issues related to their behavior, their mental health. And this is probably true for adults as well, but when we behave a certain way, at that time, the way we behave makes perfect sense to us or to themselves. And so, you know, very few kids kind of wake up in the morning and think about how they are going to just kind of misbehave today and what sort of trouble they're going to cause. Usually those things come at the moment and are really the best thing a child can think of at that time to deal with a certain situation. And the question for us as parents and as caregivers and as physicians and therapists is like, why are children choosing a certain behavior to respond to certain situations, and how can we help that situation? And so when it comes to mental health in general, and we'll probably come back to this theme again and again throughout the week, is that it's probably better to look at symptoms like anxiety, like difficulty with regulating behavior, like screaming or yelling or isolating and withdrawing, as adaptive coping strategies rather than pathology. I think it sometimes is too easy to give a child a diagnosis just based on symptoms without really understanding why are those symptoms occurring and why are we seeing this behavior and how can we help a child to maybe develop more positive and adaptive as opposed to maladaptive coping strategies. All right. So I'm trying on purpose not to use sort of big fancy jargon and medical language, because I think that's confused people for too long. I think we need to keep it simple and just start looking at some of the basic principles behind why children are behaving the way they do. And then how can we set them on a path that's going to be much more productive in the future, good for their mental health and their physical health. So when it comes to anxiety, everybody always asks this question: do we actually have an epidemic of anxiety? We hear so much about kids and anxiety in the media. Believe it or not, we do have something of an epidemic. It's hard to talk about epidemic in the midst of COVID right now, because COVID has actually worsened and exacerbated many mental health issues. But even before COVID hit, there was a lot of discussion about rising rates of anxiety. And if you go to some of the statistics, and this is statistics from the Children's Mental Health Ontario, which collects statistics exactly on these issues. And they report that many parents report having concerns about their child's anxiety, and that many kids, about a third of Ontario parents, have had a child miss school due to anxiety, and parents have had to miss work because of managing their child's anxiety, or having to stay home with their kids because they're not able to go to school. And so, and then youth self-report about their level of anxiety as well. And very few of them actually seek help for it. So only about 1 in 5 children and youth in Ontario will experience some sort of mental health problem. Sorry, as many as 1 in 5. But many of those kids will not receive the treatment they need. And that's what we're trying to change, and put kids really onto a different track and a different direction. We need to solve this problem as a society and as a community if we really want our kids to thrive and grow up to be happy, productive adults who live meaningful lives and have positive relationships and become parents themselves and parts of families themselves. And this hopefully positive influence can be passed on to the next generation as well. So I won't dwell too much on the other statistics here. You can read them for yourselves. But do we have an epidemic? Well, whether it meets the criteria for an epidemic or not, we certainly do have rising rates of anxiety. I want to put it into a bit of a perspective about what anxiety actually is. So, we can talk about kids who have fears and certain phobias. For example, many kids are afraid of the dark. But then you have to look at the kind of, where that might be one specific thing. And usually we can tackle that by kind of, addressing some of the cognitive misperceptions around what that specific fear is. Why are they afraid of spiders? Was there a negative incident with that in the past that's causing that fear now? That might be a bit more unrealistic. And we know that kids go through developmental phases where they might have certain fears and anxiety about certain things. But then there's also worry. What do you worry about? And that can sometimes, again, that's fine. Look at my last statement there. Worrying is okay. But when it leads to a plan, sorry, that's a typo there. It's not supposed to be when not, so when it leads to a plan, okay? That's when worrying is okay. And anxiety happens when worries exceed your ability to cope. So if you're able to cope with it and come up with a plan, that's fantastic. I mean, life is full of, having to worry about certain things, and life is full of stressors. But when it exceeds your ability to cope, then we, by definition, have anxiety. And, to have any sort of disorder, mental health disorder, actually diagnosed, there has to be day-to-day dysfunction. If you're not having dysfunction, you don't have a disorder. So you have to be careful not to label or to assign diagnoses when the children are actually coping relatively well. When they're meeting expectations, they're able to work through their worries, that's great, that's healthy, that's resilient. Are girls any different? We do hear that, that girls have more and higher rates of anxiety. And certainly in my practice, I tend to see more girls with anxiety than boys. Why is that? Well, we live at an age where girls are empowered to kind of be all they can be, and they should be. They should have that ability, and they should have that message brought home to them. But that can also come with more pressure, because not only are we empowering them to be all that they can be and to live up to that promise, sometimes it's like be everything. And that's not right either. Nobody can be everything to everybody all the time. And so we have to just be careful that we don't put unrealistic expectations on girls when they're growing up. They tend to face more pressure to perform and to please at school, and that can be cultural. They tend to mature faster than boys, and that tends to emphasize and heighten those differences as well. Girls and young women tend to spend more time on social media than boys do. They have more exposure to cyberbullying, and they show tendency to experience more mental health effects from that. What about social media? I mean, we hear about social media all the time, and we do see dramatic increase in anxiety and depression in children and youth since 2006. What happened then? The iPhone was introduced, and shortly after that, social media just really took off. And unfortunately, for all the good that social media has done to kind of bring the world together and to reconnect with friends and to kind of have ready access to people, especially in COVID, unfortunately, it's also had a flip side of really becoming very addictive and increasing anxiety. So we know, and this is true for everybody, you're always connected. There's always a reply expected right away. Many kids, young kids especially, just stress about not being able to respond to something right away, just in case it might be misperceived as that they don't care or that they've shunned somebody if they don't reply within 30 seconds. And so there's this constant need to kind of keep up with your social media feed, to refresh, and then look for likes. There is this high need for validation. All of us need to be validated. We need to feel like, people appreciate what we do and who we are. But it's become about living for likes, is what I call it, where, if you don't get enough likes or not as much as your friend, then maybe there's something wrong with you, and maybe you are not adequate and you are not meeting expectations. And this is huge pressure. Things can go viral very quickly. One wrong message or one sort of picture that might not be appropriate gets spread throughout the internet world at the speed of light, literally. Cyberbullying we mentioned already. How much has this led to a loss of social skills? Conversations are not happening in real time anymore. Face-to-face conversations have diminished as text conversations with emojis have risen. And it is not a substitute for that face-to-face, eye-to-eye connection. And we see a lot more kids going into the workforce and into adulthood with limited social skills and limited conversational skills, increasing rates of being shy and more isolated. And in fear of missing out, there's a recent Netflix documentary called The Social Dilemma. I encourage you all to watch it, just talking about how a lot of social media platforms, while they encourage, of course, open dialogue and communication, really the underlying bottom line is the monetary bottom line. And a lot of your data is being sold as the commodity. We are the product of a lot of social media platforms, if not all of them, where our data and information is being sold. So just check that out if you get a chance. Certainly was quite eye-opening for many people. How does anxiety manifest? You can internalize feelings of anxiety. You withdraw, you isolate, you avoid. And one of the things we'll talk about in a second is how to avoid the avoidance. Once you get onto a cycle of avoiding things and not dealing with them, it becomes easier and easier to avoid again. And so we get a lot of kids who might say miss out on one day of school, then it's 2 days, then it's 3 days, then it's I'll never catch up, I might as well miss again. And it'll just be strange if I go back now, and kids will see me and they'll comment about me, and I don't want to go back, and the anxiety heightens and the avoidance increases. Externalizing, how do we show our anxiety on the outside? Sometimes we act out, we become defiant, then afterwards might feel remorseful and then withdraw. So it can come out in many different ways. Sometimes kids with anxiety, they're just irritable, they're just cranky. I mean, they don't have the nail biting and maybe just kind of worrisome hand wringing that we see in adolescents and adults. They can sometimes just be cranky and defiant, withdraw. You're like, what's wrong? And then you realize anxiety is driving all that behavior. So what about us as parents? For those of you out there that are listening right now who are parents, you might be wondering, what can I do? Or how have I maybe even contributed to my child's anxiety? And it is true, kids watch us all the time. They see how we cope. And if we have difficulty coping with our stressors, and if we are not able to manage, kids will see that and they'll look at our coping skills and oftentimes they'll mimic that. I mean, we are our child's main examples of how to get through stress. So it's so important that we ourselves adopt healthy coping strategies as well. One of the things that's, I can think, coming more and more to the forefront is whether, there has been trauma or traumatic events or adverse childhood experiences which may have led to anxiety presentations. We know that the brain does not respond well to chronic and severe stress in early development. At that time, the brain is so susceptible. It is growing very rapidly. Neural connections are being made at like literally millions per second. When there is stress, the brain gets wired toward dealing with that stressor. And sometimes anxiety comes through as from a child who is chronically responding to stress and external threats. And so it's no wonder they live in this heightened sense of anxiety because that's all they've grown up with. And so we need to be aware of that as well, that kids who grow up in adverse conditions will often present with anxiety very early on in childhood and adolescence. So a couple of things that show up if you're talking to children, or if you have students, or if you are a grandparent and you have grandkids, or if you're in the therapy world, or if you're in the medical world. These are some characteristics of kids with anxiety. They often explain how little things can become big things, and sometimes they may not even be aware of it. But little tiny things just ruminate, and before you know it, they take over the whole brain, the whole mind, and they have what might in adults be a panic attack. All right. And so that's we call catastrophizing, where you always kind of jump to the worst case scenario. I often talk about the drama meter, where many life's experiences aren't necessarily a 10 out of 10 on the drama scale. They can be a 2 or a 3, and sometimes we just lose perspective on that. And so everything in a child's world is either 0 or it's a 10 out of 10, or 11 out of 10, or 12 out of 10. There's no in between anymore. And as a child, being able to recognize when an experience or a stressor is actually maybe only just a 2 or a 3 out of 10, maybe I don't need to get so worried and upset about it and react in that way. Maybe this is not such a big deal. And that ties to the second thought about losing perspective and just having distorted thoughts about life's experiences and life's stressors. We know that anxiety begets more anxiety, and then that increases the sensitivity to further stressors. I talk about sort of these downward spirals where just one negative experience leads to another negative experience, and then decreased self-esteem, lower expectations, and pretty soon it's a downward spiral. I would like to see kids kind of jump onto an upward spiral where positive experiences build self-esteem, build self-confidence, and get them onto this more upward spiral towards productive and healthy and thriving lives. We'll talk a little bit about physical symptoms too, because that chronic stress on the brain, that can lead to many, many physical health problems. We know that many studies have been done looking at adverse childhood experiences and how they can have a huge impact on physical health, even decades down the road. Rates of many chronic diseases that we never even thought about, like a link to our childhood experiences, have now been linked. Things like diabetes, heart disease, cancer. I mean, all of these are made worse or sometimes even triggered by chronic stress responses in early childhood. There's a great study, we'll probably talk about this more this week in other areas of child's mental health, but the Adverse Childhood Experiences study has really shone a spotlight on this. So how do we manage anxiety? I like to think about sort of 3 aspects. There's tools for the body that the child can learn about how to manage this from a what we call a somatic perspective or a bodily perspective. There's tools for the mind. How can we deal with this from a psychological perspective? And then, what are some things that your doctor might be able to help you with, and when you go see your physician, For example, are there medications that help with anxiety? So I always think you want to start off with those first two things, but sometimes you can't even get to those two things if the anxiety is really severe, and that's where the doctor might need to get involved to help with treatment and become part of the overall holistic approach. And that's what I call a biopsychosocial approach, where we really look at all aspects of a child's life and child's functioning, which is not just medication, this is going to solve everything, and it's not just just have positive thoughts and that's going to solve everything. It's a holistic approach. We have to think about all aspects of a child's functioning, which includes relationships, it includes activity, school, online activities. All those things are part of a child's world that we need to address to help manage the anxiety. And the more aspects of a child's life we can have involved, the better the outcome will be. If you just start somebody on medication, you're just going to up and up the dose until it doesn't work anymore, and then you're stuck. We need to learn strategies at the same time or even before that stage to help us get through stress and anxiety. I always tell parents, and kids, it's always difficult. It always takes work. You can't expect to just do kind of a 1 hour session once a week and think that that's going to be it. No, you got to practice, you got to learn, you got to review. It takes parents to help kids, remember what they've learned when they've talked to their counselor, or when you work through an anxiety workbook, or you have, sought some online resources to help you with this, or what the doctor said about anxiety. We have to practice that. We can't just kind of look at it as like a kind of an hour a week type activity. It should be part of our lives to practice those coping strategies. And again, I mentioned before, avoid the avoidance. If we get into an avoidant pattern, then we'll never deal with some of those stressors and learn to cope and learn to deal with them. It's best to address them head on and give kids, that confidence and ability to say like, okay, I can do this. And yeah, we need to validate, and we need to let them know that their experiences are difficult. But it should be more along the lines of, yeah, that really sucks, and I know you can get through this. All right. So it's kind of like, yes, there's empathy there. And not but, and I think you can get through this. That's empowering. So what are some tools for the body? Well, it's oftentimes just becoming aware of how you feel when you're anxious. Many kids, they come with stomach aches and headaches. We have expressions for that. It's called having butterflies in your stomach when you're about to give a speech. Sometimes we talk about worrying yourself sick. People throw up sometimes when they're really having a panic attack. Our bodies and our minds are very much connected. I mean, there are as many serotonin receptors in the rest of your body as there is in your brain. Okay, serotonin is one of those feel-good neurotransmitters, and so if we are not aware of like when we're anxious, if we just kind of interpret those as just sort of medical illnesses instead of maybe having a psychological origin, or if not just an origin, maybe they're exacerbated by how we feel psychologically, then we don't really address the root cause. So it's good for kids to learn to become aware of their bodies, to learn how they feel, and then to put words around that as well. Language is one of our most powerful tools to express ourselves and to deal with life's problems. And if we can put some language around our feelings, that would just go such a long way, not just when dealing with anxiety, but really many childhood behaviors. So we talk about grounding techniques like breathing, slows your heart rate down, gets that vagus nerve involved. It just calms. It's amazing how kids can just taking a few deep breaths. I just did it right now. I feel calmer already. So, and just practicing that technique, just square breathing, we call it. So like, imagining that you're just drawing a square in your mind, taking a big breath in, breath out, a little bit longer than your breath in, and just calming down, using that mindfulness-based technique to ground yourself to the here and now, not worrying about the past that you can't change anymore, and not worrying about the future that you're not able to predict. All right. And that leads to meditation, also physical activity. I know many kids who address much of their anxiety and their mood just by getting out, getting some exercise, Many adults do the same thing as well. They make exercise a regular part of their day to manage their stress and anxiety. Visualization, relaxation, some other techniques there as well. Tools for the mind. So what are some psychological tools that we can use? And really, it's just addressing a number of pitfalls that we can get trapped in. So, thinking that certain things are much more likely than they actually are, okay? That's like a cognitive distortion. Just talking that through with a child can sometimes be really helpful. Addressing the concept of catastrophic thinking, like we just mentioned. Empowering self-esteem by really addressing underestimated ability. Sometimes kids get stuck in a pattern like, I can never do that. I'm terrible. I will never be able to do X, Y, or Z. When in reality, they probably can, but they've already defeated themselves by those sorts of statements. Sometimes faulty memory. Sometimes we remember things in a much different way than they actually happened, and kids might think that it was much worse or much bigger than it actually was. Helping kids reprocess those experiences so that we can sort of correct some of that memory and maybe give a more accurate impression of what actually happened is really useful for kids too. And again, sort of validates why they might feel that way and helps them to move on and integrate and process those difficult experiences in a more accurate way. Perpetual questioning. We all know the kids who just ask over and over again, what's going to happen? And we sometimes just need to put a lid on that, saying, you know what, let's just do it, let's get through it, rather than, constantly asking questions, which really are sometimes never ending. I know I've got 4 kids myself, and I've been through this with some of my kids too, where they just ask you the same questions over and over again. And sometimes it just, initially it's helpful, but eventually, if it doesn't lead to a plan, it's not helpful. So it's good for kids to, expect worry in their lives. It's good to be realistic. We're not going to have stress-free lives, and there will always be something to worry about. But let's develop tools and techniques to manage that. Name the thoughts. We talked about that already. Name those feelings. To encourage kids to find the evidence. Like, okay, is that really true? Or, how many times has that happened in the past? Is that 100% likely going to happen? Or maybe 1% likely going to happen? Like, what's happened in the past? When we were in this maybe similar scenario, or when your friend was in that scenario, what happened then? We've had many storms come through Aurelia or Midland, but how many times has there actually been a tornado? Most of the time the answer is like 0 or very rarely, right? So sometimes we just get stuck without really finding the evidence, and it's good to encourage kids to really think about the evidence there. And then bossing back your word, just kind of putting a kid in charge of those thoughts and those feelings. And then if there is a time to worry, encapsulating that into like a certain time of day. Like we talk about the worry box sometimes. This is the time when we're going to bring the worry box, I'm going to open it up, let's see what's in there. Let's talk about them, maybe deal with them, maybe come up with a plan. Let's close the box. And now let's focus on relaxing before we go to bed and go to sleep, all right? Sleep time is often when this comes up, and it tends to be kind of, the more prominent time for anxiety to show up. That's why I bring it up as an example. There's some apps out there and some online tools. Again, not trying to promote your kids being online more, but there are some tools out there that help kids with calming strategies. This is definitely not an exhaustive list. There are many more out there that provide some cognitive behavior therapy and some mindfulness-based approaches that kids can use anywhere. Most kids have access now to a smartphone or a tablet or a computer or a laptop where they can employ some of these tools as well. This is one of the good ways to use screen time, and maybe minimize some of the other ways that kids are using screen time a lot. What about the doctor? Well, yes, there are some medications. I mean, that's where I get involved often if medications are required. By no means is this the first thing you want to try, of course. It really is, if we really aren't getting anywhere, or if kids are just so anxious that they can't employ or learn some of the other strategies. And these are just some examples. They all come with side effects and other risks. So again, you have to always weigh those pros and cons. But again, that's where sometimes the physician has to get involved. And again, with younger kids, for sure, you want to be extra careful. Definitely as we reach adolescence and youth, some of these strategies make more sense with more evidence and studies being available to support their efficacy. So sometimes your family doctor is able to manage this. Other times you need to get a pediatrician or a child psychiatrist involved to go down this level of treatment. So I'll go back to the statement again. From a child's perspective, the way they're reacting at that point makes complete 100% sense to themselves. This is the best way that they've come up with coping with this particular stressor or this particular event. And so when we see kids being anxious, we have to sympathize with them. I mean, this is the best response they've come up with, not wanting to go to school, or their body's responding with physical aches and pains. And we have to help them through this and sort that out as to say, well, why is this their best response? Why are they going this route to respond to some of the stress and worries and anxiety in their lives? And how can we, as adults, model maybe a better way for them so that they are not rendered dysfunctional or paralyzed by their anxiety and their worries to the point where they're really missing out on the joys of life and the things that children and teenagers should be enjoying at this stage in their life, and promoting development, healthy relationships, etc. All right, that is sort of the extent of the talk that I had prepared today. Actually went faster than I thought it was going to go. So maybe I talked too fast, who knows? But I am certainly open to any questions. I'm not sure if we're able to facilitate that somehow, or what the best way is to do that. Maybe I'll stop sharing my screen and maybe open it up to any comments or questions or thoughts on this.
Hi, Rob. There's a couple questions in the chat.
Yes, I just opened up my chat, and I see here, what are the red flags I should be looking for in my child? How do I identify the difference between having a kid who is a worrier and a kid with anxiety? What can I do to help my kid in either cases? Okay, so I can definitely address that, and it's come back to one of the slides I showed earlier, where there's a difference between worrying and anxiety. When worrying is good, when it leads to a plan. So when you come out of a kind of a session of talking about a child's worries, and it says, okay, you know what, tomorrow when I see that kid, I'm going to do this. Or tomorrow when this happens, I think this is a good way that I'm going to try and respond. So when it leads to a plan, that's great. That's problem solving, and that's healthy and productive. But when it leads, when worries lead to what I call day-to-day dysfunction, and that can be somewhat subjective and different for everybody and for the child too. But generally, if a child is missing out on things that other kids their age would be otherwise enjoying, then we're dealing with a disorder. So if a child's not able to go to school, obviously, because of anxiety, all right? And I'm not talking about COVID here, we're doing online learning because of many other reasons why kids need to do online learning. But in any other time, if a child's unable to go to certain social situations like birthday parties or a party or a friend's house, or if they've previously enjoyed sleepovers and now they don't want to go anymore, or if they're really missing out on a club or a sport or something like that, which they normally maybe enjoyed in the past, or which many of their friends would be able to enjoy, then we know we're dealing with a disorder, and then we're talking about more of an anxiety disorder, right? If there's panic attacks, if there's bodily feelings that are associated with that worry, if those become overwhelming and exceed a child's ability to cope, then we're dealing with a disorder that needs to be addressed professionally, and with your help as a parent, with the teacher's help if necessary, and that's applicable, with a therapist or a counselor, And then sometimes, like I mentioned at the end there, a physician needs to get involved. I hope that answers that question. How can I get my child to open up? I know they are worrying, but I don't know why. Okay. Yeah, it's tough sometimes. First of all, it's hard with young kids because they don't really often have the language around expressing their worries and their fears. And so, you know, it sometimes comes out in kind of spits and spurts. It might come out more as behaviors, like we mentioned earlier, and so it's really good at an early age to start helping kids identify their emotions by using their words. Is that frustration? Is that stress? Are you angry? Are you sad? Are you worried? Are you exasperated? You know, those are some words that children can learn at a young age. That should become part of their vocabulary, so that they don't feel limited by their inability to use language. Because ultimately, it's language. Don't you want all your colleagues at work to use their words as opposed to their behavior, to express their worries, anxieties, and their fears and their stresses? And then the other group of individuals is the teenagers, all right? And they are notoriously, you know, they may not communicate because they don't want to tell you. And you just get shoulder shrugs, and or you just get, I don't know. Again, some of those kids might have a learning disability or language disability where they don't know how to communicate their worries and anxiety, have never practiced it. They may have felt threatened by doing that. They might have felt like, you know, they're going to get in trouble or judged by expressing their worries and anxieties. And so it's just so important to just fight for that relationship with your teenager just from such an early age, so that when they do have anxiety and worries, that they're able to use their words because you've, you know, encouraged that when they were young, and you are going to listen to them and you're going to validate their feelings. Okay, if you know, come at them with more, and it's not on purpose. We don't do this as parents. We don't necessarily go out to, you know, exasperate our kids, but if we kind of judge, or if we come across as being judgmental, or that without validating their feelings, they're not going to open up the next time. So really having that open channel of communication with your child is just so important. And then sometimes it's also useful just to get a neutral third party involved. All right, if your teenager especially is open to seeing a counselor, and there's many at the schools now, they're at the family health teams have counselors available. There is online resource as well. There's a Big White Wall and Bounce Back for adolescents, which are maybe a bit more neutral and a bit less threatening for kids. Those would be options as well. Check out the North Simcoe Youth Wellness Hub. So many resources there for kids, for youth, by youth. All right. If there's ever was a non-threatening environment, it's the North Simcoe Youth Wellness Hub. So there's a plug for that. All right. Let me see. Okay, what are risks? I'm not sure if I'm getting to all the questions, but what are the risks of anxiety medication and antidepressants for kids? So it depends which ones you use. Generally, like things like the SSRI medication, that's like Prozac and Zoloft, generally are relatively well tolerated. We always give that little black box warning with those medications that says that there have been some studies that show increased risk for suicidal ideation, especially early on in treatment, especially in kids who are depressed and starting on one of these medications. They need to be monitored carefully. Sometimes what we think is that the activity level elevates before the mood elevates, and that can sometimes cause some problems early on while you're titrating that medication. It's rare, but we always mention it's something to look out for. And again, that's why it's important to have that open channel communication when you're starting out on a treatment to make sure that it's actually beneficial. The other thing is sometimes they just cause a bit of stomach upsets. We say take it with food. For older adolescents and adults, it also, sometimes these medications might decrease libido and things like that. It's different for everybody, so you just need to be just aware and maybe a bit more cognizant of some of these side effects when you're starting out on a course of therapy like that. If you've determined that your child's anxiety is impacting their daily functioning and would like to get some support, what would you say as a first step? Are there options aside from seeing your family physician? Yeah, absolutely. Again, family health team counselors at the North Simcoe Family Health Team, where I'm actually in a clinic room there today seeing kids. But there are counselors available here. There is New Path, which they have a walk-in clinic. Just check out their their website, newpath.ca. Canark has some walk-in options, or I believe they have walk-in options as well, but they are located in Midland as well. It depends where you are too, what services are available. If you're in Muskoka, it's sort of a different set of connections there, but just assuming right now we're dealing with sort of the Midland area, those would be your best options. There's lots of private counselors as well, so if you have a plan or an employee assistance program that provides for counseling, you could check that out as well. And then lastly, schools have really taken this on. There are many mental health and addictions nurses that now go through the various schools. They're not there every day. High schools generally have more steady availability and access to those nurses, but they are there. And I think maybe a simple conversation with the school principal might get you connected with one of those as well. There are many options to go before having to go see your family doctor, and definitely before seeing myself. I certainly don't have the capacity to see all kids with anxiety, and there are many, many better things to do first before coming to see me. Do you have any thoughts on what we might expect as a result of COVID-19? Yes, COVID-19 is not a good situation for kids. It has isolated our teenagers. It has withdrawn many of the supports that we have so benefited from and that were actually improving before COVID hit. We see so many kids that are just not able to spend time with their friends. Teenagers just need to be around other teenagers. And here they're getting the message, socially distance, physical distance. It's just so hard on our teenagers. And so I really feel for them. I really hope that COVID fizzles soon. I hope we have a treatment, a cure, a vaccine, whatever it takes to make this a thing of the past. But we are acutely aware of what we call the fourth wave, which is the mental health wave. Also, we know COVID has put a huge strain on families and on relationships. We are expecting increased family separation to occur and impaired relationships to result from COVID, unfortunately, with job loss and financial insecurity. And that's just going to trickle down to the kids, obviously, as well. And so, yes, mental health needs are unfortunately going to increase for our children and youth. So anything that we can do to raise awareness and to provide support, of course, would be huge. Let's see, I'm just trying to scan through questions while I'm talking, and I probably said some wrong things while I'm talking because I'm trying to scan, and I probably missed some things on the scan because I was talking. So maybe Holly knows if there's anybody else that I am missing here or anything else that has come up.
I think you got most of them here, Rob. There's one more that was just added at the very bottom, but I think you got all the ones up top.
Okay, yes, I see it now. So my family discusses COVID-19 frequently, and my young child is now constantly discussing the pandemic, expressing concern over the rules or recites the rules. What can we do to reduce the worry we have contributed to unintentionally? Yeah, so there was of course, there's huge anxiety in everybody. I mean, it almost would have been weird if you weren't anxious about COVID at the beginning. And, there still needs to be vigilant and to, have some level of healthy anxiety around COVID to make sure that we all follow sort of guidelines to keep everybody safe. But we have seen some kids who have really been taken by this and latched on to a very rigid interpretation of the rules and regulations, a very limited ability to cope with any sort of perceived deviance from those recommendations. And then we do start to get into the anxiety disorder domain. mean, when we are so rigid to the point where we almost become obsessive about it and compulsive about, say, hand washing or sanitizing to the point where it's above and beyond the recommendations, we have to really dig underneath that and go like, okay, whoa, what's going on here? And maybe we have unintentionally contributed to that level of anxiety. And that's where we as adults need to provide some level of perspective. I've had to do this with many families around, school reopening. I think there's a healthy level of anxiety about school reopening, and then there's an excessive level of anxiety about that. And it's a fluid situation; it's constantly changing. But we need to, as adults, provide perspective to our kids and also model for them just healthy coping and healthy stress response in these times of uncertainty. I mean, if we are anxious and worried and having panic attack, our kids are for sure as well. So if we can kind of just stay calm and reasonable, use that, cortical part of our brain as opposed, what I call the wizard brain, as opposed to the lizard brain, that deeper part inside that tends to overreact and hyperreact to things, then we model that for our kids, and our kids will be the better for it. So I hope that answers that question. But yeah, COVID has not been friendly for our kids' mental health. And I do hope that we are able to support our kids and ourselves. I mean, we need to look after ourselves too. So yeah, that's, so somebody put a comment there. I have a COVID-19 booklet that children can work through. It's to help work through the anxiety in children. If you'd like a copy, email me. Thanks, Kaylin. That's fantastic. Awesome. Yeah, there are actually almost every mental health organization, if you go to their website, many of them will have COVID-19 resources. People have obviously thought about this. So if you go to even cmho.org, which is the Children's Mental Health Organization.org, it has lots of resources. Sick Kids has lots of resources for kids as well. Those are just two off the top of my mind that I could think of where you can go to find further resources about helping your child manage the COVID-19 pandemic from a mental health perspective.
Rob, do you think you could maybe give a few pointers for resilience building for families as well as kids? So just kind of flip to the positive on some of those things that people can do to help build those skills.
Yes. So resilience is your ability to cope with life stressors. And just so you know, like we talk about anxiety here, but many kids are being so resilient through this whole current crisis and through their lives. They build these coping skills. How do we build resilience? One of the biggest things is community and positive relationships. And that's just talking about, sort of the nuclear family, that extended family. All right. We know that kids who have more extended family involved in their lives is a huge supportive factor. Grandparents, aunts and uncles, cousins, people who are just implicitly there for you when you need them. And outside of your immediate family circle, right? I mean, we have the strongest attachment usually to our parents, and then, to our siblings, although it might not seem that way at times. But, our extended family is huge. The other thing that I think is very resilience building is sports and physical activity, but sports in terms of like just building, social skills, team skills, body awareness. Obviously, physical activity is just healthy from a physical perspective, and being physically healthy will certainly help you become more resilient as well. And then part of a community. So, if it's a faith community or it's another community organization where your child can just be built up with, positive energy, that positive self-esteem. And again, just building a team around your child, whether it's that extended family or whether it's a coach, whether it's a mentor, it'll purposely reach out to people and say like, hey, will you get involved with my child to kind of take them out or coach them or, talk to them about some of the things that you deal with in your life. So I think really building that team around your child can be so resilience enhancing. And it's so great for kids.